I'm Dr. Gordon, and this is the classroom technique DVD, Gordon MUA Technique. I have participants from the facility that I use here in Florida with me. I have Dr. Brian, and Dr. Adam is going to be the patient, Dr. Kevin Burrell, and Dr. Dave. And what we're doing is we're actually going to put together the teaching program protocol for the course so that you can follow what I do when I teach the course, and makes it easier for you to understand if you actually see the technique being done. So I'll have Dr. Brian act as the attending doctor and Dr. Kevin act as the co-attending doctor, and this is basically what we will do in class. And what I'll do is I'll tell the doctors what to do, and they'll follow through with the procedure just like you'll do when you're in class in the classroom setting. So first thing we're going to do is have the co-attending take hold of the shoulders, then we're going to have the attending take hold of the axial spine and do axial traction. Okay? That traction then goes to lateral traction, and the entire body is moved with lateral traction. And then we come to the other side and we do the same type of traction. Now notice that the co-attending is tractioning down on the opposite side as he does that traction. Come back to the center, and we're going to do straight flexion, chin to chest. When he does that, the co-attending pushes down on the shoulder, because what he's doing in the process of doing this procedure is to counteract every stretch that we do. Come back to the center line, halfway down you're going to cross your hands underneath the cervical spine. Here we're trying to get T1 and T2 off the table. And again, co-attending is tractioning down away from the stretch. Okay, the head is removed all the way down to the table. Okay, now roll one ear into the palm of your hand. That places the patient in rotation. Then we're going to reach up under, and we're going to do lower cervical obliques with this stretch. Maintain the traction, take the hand out from underneath, put it on the angle of the jaw, and we do upper cervical obliques with that. Okay, now we're going to come back and do the same thing on the opposite side. Roll the ear into the palm of your hand, lift up, lower cervical obliques, and then put your hand on the angle of the jaw and lift up for the upper cervical obliques. All right, we bring the patient's head all the way down. Next thing he's going to do is stair step. So he's going to bring his fingers into the facets like this and push up all the way up the spine. And what we're trying to do with this is to open up the fibrotic tissue that is contracted around the facet joints. The cervical adjustment comes next, and because you did that release of the fibrotic tissue, the cervical adjustment's easier to go. Now, understand, when the patient is in a restful sleep, the cervical adjustment is not a harsh adjustment. Actually, what Dr. Brian is going through right now is very similar to what the movement would be with a patient that is sleeping. Okay? The next move that we're going to do is what we call a single arm lift. So we take the arm, we reach outside the carpal tunnel, and when he does this, he forms a triangle. And when he forms a triangle, he's going to reach down inside the triangle and reach down as far as he can. Co-attending is going to support the hip on that side, and they're going to traction back away from the body first and then come medial toward the head. That's when you're going to feel the pull. Okay, come back. Now the next thing he's going to do is the opposite hand. Okay, he's going to reach outside the carpal tunnel. There's his triangle. Okay, he's going to reach down inside the triangle all the way down to the lat, as close down as he can, and pull back, and then come across the top of the head. Good. Notice the co-attending on this side is pulling the hip back away, so we have a counter traction. All right, put the hands back. Now what we're going to do is what we call a bilateral rhomboid lift. Okay, we're going to take the arms out to the side, lock them under your arm, hold it at the elbow, reach the hand up into where the rhomboids are, and on either